All right, welcome back. I'm here with Shawn Smith. Shawn, tell me about what you do, what organization you're representing today.
Well, thank you. It's an honor and a pleasure to be here. My name is Shawn Smith. I'm with One True Health. We're a digital health company that focuses on helping older adults to manage chronic and acute conditions, diabetes, hypertension, heart disease, by spending more time where they spend all of their time, which is at home, not necessarily in front of the doctor.
Perfect. What got you into this field? What makes you passionate about working with older adults and elder care?
I've been in digital health my entire career. This is my fourth digital health startup. And I'm just really passionate now about seeing what happened after COVID, where so many older adults had the attention that they needed before COVID to manage chronic and acute conditions, but now there aren't case managers anymore. There aren't people following them home where they spend 99% of their time. So they're basically their own doctor trying to manage all these different conditions and to even get daily tasks orchestrated and completed.
So that kind of brings us into our last question. I mean, you talked about people not being able to get the care that they received, waning resources for older adults. So what is that big problem that you think is in elder care, and then how is One True Health addressing that problem?
Well, the biggest problem that we see in the market is patient engagement. So you have clinical practices that are having a hard time getting their patients back into their facility for revenue generating encounters. You have hospitals with patients in transition that see recidivism. They're coming back to the emergency department because they're not following care plan instructions. You see senior living communities where they have 86% have moderate to severe staffing shortages. So they need help making sure that dad walks and takes his meds and he has 24/7 telehealth. Engaging that person and helping them to live a better life dealing with their chronic conditions and acute conditions at home is the big problem. So what we're offering is not only a human touch, actual care navigators that will come speak with the patient, help them with physiological monitoring, chronic condition management, transitional care management, but we also have a 24/7 available virtual care companion. It's either a text or voice or an avatar, and it'll come alongside and it'll actually engage that patient to help them conduct daily tasks. Think of a woman from cancer recovery who's tired, she's nauseous, still has to get a meal on the table, the kid's picked up, and the guy that mowed the lawn paid. How much could AI help her with that? Or if someone in the middle of the night is having a elevated heart rate or blood pressure, could AI come alongside at 3 a.m. in the morning and help them to monitor those conditions? If Susie's supposed to walk 10 minutes a day, AI can come on board and say, hey, I see you haven't walked today, grab your jacket, it's 50 degrees outside and I'm going to play a little Bob Dylan on the way, because it's a personalized solution. We try to provide 24/7 available premium health experience, which you don't normally get in a healthcare delivery system.
Exactly.
But that's our focus at One True Health. Better engage the patient, help them live a longer and happier and better life.
I mean, it definitely sounds like a really comprehensive, robust solution that you guys have at One True Health. How do you actually reach the consumer, right? Are you going direct to them? Are you going through the employer, the healthcare provider? How would they get to you?
So we're a B2B2C play. So our customers are clinical practices, again, wanting to better engage that patient in the home because they don't have the case managers to do it anymore. It might be a hospital that's making sure that folks with COPD or total knee, total hip transitions don't come back to the facility. It might be that senior living community that wants to get a better resident experience. That's a marketing advantage over the next facility down the street. So that's what we do, and we're engaging with them, and they're providing us the individuals, but the ultimate beneficiary of what we do is that consumer.
Of course.
That's getting a 24/7 health experience.
Talk about the premium service, right? You definitely want that to reach the end consumer,
That's right?
That's who matters in this situation.
Exactly.
So if you are one of these employers, these senior living facilities or these healthcare systems, how can they get in contact with you? How can they learn more about One True Health if they're interested?
Thanks. Well, so go to onetruehealth.com, the number onetruehealth.com. Easiest way to reach out to us. We'll actually engage your clinical practice, the hospital, anybody you want. We'll figure out who you go to for your care. And we're also about to come out with our first direct-to-consumer application focused on cognitive assessments. So if you have yourself or a loved one that you feel might need to be assessed for mild to moderate cognitive impairment, we can do that for them in a direct-to-consumer application.
Very cool. Well, again, sounds like One True Health is a great solution. I appreciate you talking with me.
Thank you. Such an honor. Thank you.